I'm Roger Weir. I'm an associate professor of neurology at Howard University College of Medicine. I'm also an attending physician in Howard University Hospital. I went to medical school basically at London University. It has several places, of course, but I was at St. Bartholomew's Hospital. Subjects which I did in medical school, which I have found most useful for my career, are probably neuroanatomy. Neuroanatomy has great importance in itself, in the sense that, let us say, if I am seeing things, the vision is specifically going on in the back of the brain. The eyes do the work of the front of the brain. If I am talking, much of that talking is controlled by the left side of the brain, and so you come to the neuroanatomy of the brain in healthy people, and then there's the neuroanatomy of the brain in people with different illnesses. The neuroanatomy is now probably most useful in the sense that it is what you see on the imaging studies of the brain. So if you were to go for a CAT scan of your brain or an MRI of your brain, it is really sort of how does that anatomy in the normal brain look on the imaging study, and of course also how does it look when something goes wrong. I chose neurology, I'm sure because in part I like the complexity of the brain, but also because I wanted to understand it and work with it. It is an ongoing field. I've been here for 49 years, going on 50. One of the larger changes is, of course, that when I came here, we were in Freedman's Hospital. This hospital, Howard University Hospital, was being built at that time, and we moved here in April of 1975. At that time, in the 70s and so forth, this was a 500-bed or over hospital, and it was basically full. It was full a lot of the time, quite busy. Things have sort of gradually changed over the years. One of the larger changes, of course, occurred almost exactly a year ago. I heard about Zoom. I heard we were preparing to give lectures on Zoom. Now there is Zoom for patient care. There's Zoom for many conferences. This is a gigantic factor for the medical students, second year, third year, fourth year. Much smaller factor for the residents who see patients all the time, same as I do, perhaps even more so than I do. And there are Zoom conferences, which are actually very valuable. And some of it has shown that there are things you can do with the telephone telehealth, where you can have actually a great follow-up for important conditions which can be handled very well. You can see where some would be handled much better in person, but it is a sort of new role for something which would be quite valuable. Principally intellectual. You have a neurologic examination, which became defined probably somewhere over 100 years ago. But really, as the imaging studies have gotten better and better, the neurologic skills have dropped somewhat. But it is really listening, talking, analyzing, correlating that are the highest values when I work on a day-to-day basis. The career advice that I would give and try to give to my students is basically to make a big effort, okay? And to understand that there's a lot of the common stuff and the basic stuff that you have to do right almost every time. There's other stuff you want to be able to do it sometimes, but healthcare is like many circumstances. Character and putting that character in what you do repetitively is a giant part of doing the job either adequately or well, not to mention better than that. Oliver Sacks is, I would say he is a great medical writer. He wrote on awakenings, and people read it and decided to make a great movie out of it, and of course that moves the topic along. He liked to be able to tell a great story, and I think he could tell great stories, and he was greatly involved in many parts of neurology.